Air travel will be different as COVID-19 cases with new protocols to make sure passengers are virus-free. The public will also want to feel confident before taking to the skies again. Gwyneth with more.
Temperature screenings and preventing those with symptoms from flying. These could become a norm post-COVID-19 until a vaccine or instant virus test exists. The International Air Transport Association says it is still discussing such details with governments and industry. However, an aviation expert says airlines may also offer different options as a form of psychological reassurance to drive demand.
Some of them are offering some of the passengers to buy out a seat next to them. So if we look at some of the budget carriers, AirAsia, for example, they are equipping the crew members with protective equipment. Now, can passengers do the same if they have the concern? If they do that, it's probably cheaper than to buy out the seat next to them to be empty, right? So there are different combinations that airlines can try out.
IATA says it doesn't think safe distancing on planes is needed, as limited evidence so far shows a low chance of transmission on board. Instead, airlines should limit people moving on board and offer simpler meal services to reduce interaction. Masks will also offer protection. Professor Fan says recent examples of crowded flights after measures were eased in the US and Europe show there's still eagerness to travel. Airlines will also play their part.
We can look back at some of the major airline accidents, for example, the airplane accidents. And what we have seen is that typically after those accidents, airlines will wait for a few months, maybe 3-4 months, before they then launch some really deep price discounts. And when they do that, typically when the price is right, people are gradually willing to take the risk and then fly again.
Professor Fan says travel restrictions such as 14-day quarantine measures will also have to be lifted before people feel it's convenient to travel again.